think it's interesting that it wasn't discovered until 1977 in the US, and it was discovered in the town of Lyme, Connecticut. So in my research, I learned that it isn't Lyme's disease or Lyme's, as most people, in this region of Pennsylvania call it. It's just Lyme, no S, and it's named after this town in Connecticut where they found all these cases of children or adolescents that were developing arthritis symptoms and joint pain. So they started looking, is this autoimmune disease? Is this something in the water, in the food? And they were able to trace it back to ticks, and specifically the deer tick carrying a bacteria, which is Lyme disease. My name is Nicole Paronish, and this is my advice. I'm a clinical pharmacist by trade, but increasingly a growing concerned citizen about the increasing rates of tick population and cases of tick-borne illness. So there's about 90 different types of ticks in the United States, but hundreds more globally. But I really only want to talk today about one type of tick, which is the black-legged tick, or more commonly known as the deer tick. And the reason for this is it alone is the #1 cause of vector-borne illness in the United States, which is Lyme disease. And when I say vector-borne, I mean coming from a mosquito, a flea, a tick that then infects a human with a pathogen or disease. So we think of malaria and we think of West Nile being things that come from mosquitoes in other parts of the world. But here in the US, the #1 cause is a deer tick that's causing Lyme disease. While I do have a medical background, my passion for Lyme disease didn't come from my medical training. In fact, when I went to school, we never learned about Lyme disease. In fact, we didn't talk about any tick-borne illness at all. It really started when I moved back up north to my hometown in Pennsylvania in 2016. And I moved here with my dog. We'd go for walks, and I'd start noticing ticks on myself or on the dog. And I'd start to hear from all my friends and family and just people in the area about how many people had contracted Lyme disease in this area. And some people's stories were really poignant. A friend I went to high school with in her 20s, her first thing is she was complaining that her pinky finger, the one joint, kept swelling up. And then it ended up progressing. She had a bunch of muscle wasting, weight loss. She was always feeling confused, like brain fog. She would tell the doctors, like, I can't form a sentence. I feel like I'm drunk. She had tingling in her limbs and numbness. So she saw doctor after doctor. They all ran the same sorts of tests. They all told her she was fine. And she eventually saw a specialist, and the specialist diagnosed her with Lyme disease and treated her. And most of those symptoms did resolve, but still to this day, she's in her 30s, she still gets flare-ups of Lyme disease. We had another family friend who was in her 30s, same sort of symptoms, and kept going to doctor after doctor. She was tested for MS. She was told she had fibromyalgia. Ultimately, she was diagnosed with Lyme disease, but she's in her 40s now, and she's largely bedbound. She's from the joint pain, from just feeling so fatigued all the time. She spends most of her time in bed. So, from that, I started to have some more personal experiences with Lyme disease where my dog at the time had started to just act different, really tired all the time, really grouchy. She actually snapped at my boyfriend's face and had never behaved like that before. And she was limping on her front paw. So I told a vet friend about it, and she said, oh, that can be a symptom of Lyme disease. And I was really, I rushed my dog to the vet and got tested and was positive for Lyme antibodies, and they gave her antibiotics. The limp went away, and she went right back to her energetic, normal self. So, that was kind of the first personal experience. And then we had a 9-year-old boy in our family who, kind of similar to the dog, ended up having abrupt personality change. He was just a happy-go-lucky boy. He started getting really angry, crying at everything. And a few weeks later, he ended up getting a rash all over his rib cage. And it was just a generalized rash, just little red dots, not itchy. But his mom took him to the pediatrician, and thankfully they tested him for Lyme disease. And he tested positive for Lyme antibodies and was given antibiotics, and all of that resolved. He just went back to his happy-go-lucky, normal, 9-year-old self. Fast forward about 7 years forward from that, and this same boy, he abruptly, out of nowhere, started having panic attacks, anxiety attacks. he was started on an SSRI for depression. And his father remembered the last time he had the Lyme disease, and he lives in an area where, he has a bunch of dogs that live outdoors, and they've been found riddled with ticks. He lives kind of on a farm. There's farm animals there. So he insisted on taking him in and getting a workup at least, check his thyroid. Is that causing these mental health things? Check another Lyme antibody level. That came back positive, and they decided just because of probably low risk, they treated him with antibiotics. All of his anxiety attacks, panic attacks had stopped within a couple weeks of finishing the antibiotics. So since then, he's come off the SSRI. It's been about a year, no further symptoms. So some of these are pretty dramatic, I think, but I've also had some experiences where people have a lot more of the traditional symptoms of Lyme disease. So my one cousin developed a fever, developed a severe headache, went into urgent care, and they looked at him all over, did the full body exam, and found a big bullseye rash behind his knee. Treated him for Lyme disease, symptoms resolved. And so for me, kind of the takeaway point from all of these stories, and these are all people that I know personally or friends of friends, not a single one of them ever saw a tick burrowed into them. Another really big point is that a lot of them did seek out medical attention, and time after time, it was missed by the medical community. So I think both of those are really big, takeaway points about why it's important for everybody to at least have in the back of their minds some knowledge about Lyme disease, the possible symptoms, and be ready to advocate for yourself if you think you might potentially have exposure to a tick or have Lyme disease. This has all led me to really start researching, tick-borne illness, Lyme disease. Myself, I've never had any symptoms of Lyme disease, and also I have been tested twice just because of the number of ticks I've seen, because I've had ticks in myself and my Lyme antibodies were negative. Ticks don't innately carry Lyme disease. Even if the mother would have had Lyme disease, it doesn't get passed on to a tick that way. So they're born, they're not carrying any Lyme disease, but they're parasites. They really need to feed off of a host and get blood to have nutrients to grow. And so what will happen is these little larvae will attach to a host and feed, and then they develop into a nymph stage. Now, nymphs are about the size of a poppy seed, but it will go through one more transformation. After feeding again on a second host, it will turn into adult deer tick. So you either have a male or female adult deer tick. Those are about the size of a sesame seed. So even at the largest, we're looking at about 3 millimeters across if they're not feeding, if they're not engorged. So that speaks to the importance of, how hard they are to see, and why, you could potentially have a tick bite and not even, notice it. But how it works with ticks, I think it's pretty neat. They typically, at all 3 stages, they'll crawl up a blade of grass or a tree. They actually hold on with one side of their legs, and the other side of their legs, they reach out, and it's called questing. And they wait for something to brush up against it, and they grab on to what walks by. And so they're really, they'll take advantage of whatever it is. That's why if it's, a deer, if it's a human, if it's a dog, whatever brushes up against it, they'll grab a hold of. And when they're in their smallest stages, when they're larvae or whenever they're in that nymph stage, they typically feed on very small animals, maybe birds, rodents, something that would, be lower to the ground. And why this is relevant is because where most Lyme disease occurs, where it starts, so they call this the reservoir, that they are in rodents, specifically one type of mice in the US. And so when these ticks feed off these mice or rodents, that is when they're contracting Lyme disease. And from that point forward, anything that the tick feeds on, ultimately, they have the chance of, passing along Lyme disease to that host. So people say deer ticks, and they think that deer are the reservoir or where the Lyme disease is coming from. But deer actually don't get infected by Lyme disease. So even if they are bitten or a tick feeds off them with Lyme disease, they don't get it, and they also can't pass it along. So it's really the rodents that are to blame: chipmunks, squirrels, but mostly this one type of mouse that's found. Hence the name, the deer tick. The reason it's named that is because their preferred host, what they want to feed on, is a white-tailed deer. And that's why in regions where white-tailed deer are common, the woodlands, big grassy areas, fields, that's where you find white-tailed deer. That's also where you're going to find the deer ticks. That's what they're hoping to feed off of. So that's why Lyme disease is typically associated with, going in the woods, going in the field, going in large grassy or high grassy areas, because if the deer might be there, the deer ticks might be there. Penn State University did a study on a lot of the counties in Pennsylvania, and they saw about 50% of deer ticks are carrying Lyme disease. And this was backed up by another study, an IUP, Indiana University of Pennsylvania professor. He went to the urban parks in Pittsburgh, so places that are green spaces completely surrounded by the city, and found about 200 adult deer ticks, 50% carried Lyme disease. They found about 500 nymphs, so the smaller size, and about 20% were carrying Lyme disease. So even in an urban area, even in a city, you go to the green space, you go to the park, and we're finding huge numbers of ticks and huge numbers that are carrying Lyme disease. About 95% of Lyme disease cases in the U.S. are found in the Northeast and the Northern Midwest. So that's where it's most common, but to the best of my knowledge, there's been a case in every continental U.S. state. So they are spreading. Even if you're, somewhere in the South or way out in the West Coast, there have been cases of Lyme disease out there. So it's something to be aware of no matter where you're at, or if you're traveling, especially to the Northeast, to the Northern Midwest, and you're doing some outdoor type activity, it's good to know when you go back home that could have been a potential exposure. In the US each year, there's about 30,000 confirmed Lyme disease cases, but the CDC estimates that it's at least 10 times that. So it's estimated above 450,000 cases of Lyme disease a year in the US. And of that, about 100,000 of those are supposed to be in Pennsylvania. So Pennsylvania leads the nation in Lyme disease cases, unless you're talking about per capita. So if you're talking about how many out of 100,000 residents of a state have Lyme disease, that's led by Maine. So it is a bacterial infection, and because of that, we can use some antibiotics to treat it. And the sooner you get it treated, the more likely you are to cure it. When you get more chronic Lyme disease that hasn't been treated for months or years, it gets a lot more difficult to treat, and the antibiotics aren't necessarily as effective against it. But Lyme disease is most common from May to October, and the reason for this has to do with the life cycle of the tick. So those nymphs, that middle stage, that's when they're occurring, is kind of in the spring into summer. And they're what are most likely to transmit Lyme disease, probably because of their size, and you don't identify them, because adult ticks actually are more likely to have Lyme disease by that point in their life, but nymphs are actually more likely to cause Lyme disease overall. I think it's really important for people to know that people think in the winter, especially in the Northeast or in Pennsylvania, that, ticks aren't a problem. I know so many people that treat their animals for ticks only in the spring and summer. I have seen deer ticks after 3 feet of snow that melts, and I've seen a deer tick. In freezing temperatures, I've seen deer ticks, like every month of the year. And this is December, so about, 2 weeks ago, maybe 10 days ago, I got into my car, looked over in the morning, and there was a deer tick on my front seat. Hadn't been in the car since the day before that. And I did take my dog out, and he sits in the front seat. But we went to an area that's largely a gravel road with some grass, a couple trees, but not an area that you would think of being a big, likely to have ticks. So I'm not sure if it came off him from the day before, but was sitting on my front seat in the morning in December in Pennsylvania. So all times of the year you can find them. Let's talk about what would happen if you did get bit by a tick and it was carrying Lyme disease. So first of all, you generally will not feel a tick bite. Their saliva has a numbing agent in it, so you're very unlikely to feel that you got bit by a tick. And they like your cracks and crevices. They like warm areas. So they're going to travel a lot of times to your armpits, behind your knees, your butt crack, behind your ears, all those places that you're not generally going to be looking at. You're not necessarily going to see just in your day-to-day life unless you're looking. But let's say you didn't see the tick, so it could be two things. You didn't see it at all, and eventually you find it, and it's engorged, and you haven't checked. You don't know how long it's been on there. Or the other thing that happens, the tick only feeds for about 3 to 6 days, and then it naturally falls off. So you didn't catch it in that 3 to 6 day period. What happens? So about 3 days later, up to 30 days later, but it's usually about a week, you can start to develop just generalized symptoms. And what they look like, one of the things is called the summertime flu. Because flu symptoms, you don't get the flu in the summer, but people come in with fever, really severe headache, really tired or achy in the middle of the summertime. And that's actually, especially if you live in the Northeast or an area that's endemic to Lyme disease, that's a big sign of a potential, this could be a case of Lyme disease. The other main thing that people talk about is this characteristic rash that's the bullseye rash. And so that occurs typically at the site of the tick bite. So it's red in the center, white around the edge, and then red further out. And it's an expanding rash. So if you keep an eye on it, it generally keeps expanding. And that is pretty indicative of Lyme disease. If you have that, definitely, get to the doctor. Definitely should be treated for Lyme disease. But it's important to know too that it doesn't always look like a bullseye. It can just be red around it. It can also, you can have no rash at all. So that's something that, is kind of a misconception. If you look at positive Lyme antibodies with symptoms, only about 50% of people actually ever saw a rash. So important to know that if you have that, that's really important. But if you don't, it could still be Lyme disease. That's right at first. That's acute Lyme disease, right? The symptoms that you may experience. But the problem is if it goes untreated, especially if you're getting 3 and 6 months out and you haven't treated the Lyme disease, it spreads to other parts of the body. One of the main ones being joints. So Lyme arthritis is very well known. It's the main long-term problem with chronic Lyme disease. So I think the scary part there is, let's say, you hunt every day, you're in your 60s, you go to the doctor and say, hey, my knee is really swollen, it's hurting. And they're like, oh yeah, it looks like arthritis. Oh, you're in your 60s, it's wear and tear, it's age. And there probably wouldn't be much thought further than that into it. And that's an important thing to note is arthritis is the number one long-term effect of untreated Lyme disease in our country. It's actually different in Europe and Asia, but here, that's the main thing. It can also attack your nervous system, so nerve pain. Another thing is it can cause facial paralysis, so facial palsy, drooping of your face. Some of those symptoms I talked about that, my friends had, really fogginess, confusion, feeling really extremely tired. Again, I think of somebody, especially as we age, if you go into the doctors and say, oh, I'm having a hard time, putting together sentences and, I feel a little confused. I feel like they're like, oh, well, you're aging, it could be potentially dementia. And it might be. It's not to say that that doesn't occur, but important to note that, again, especially in combination with some of these other things, that they're very characteristic of Lyme disease. Other neurologic conditions, meningitis, psychiatric symptoms, so depression, anxiety, have been associated with Lyme disease chronically. And then your heart. So that's a big thing that Lyme disease can attack your heart. Lyme carditis, the CDC released some reports of young, healthy people dying suddenly from heart block or myocarditis from Lyme disease. So that's a little more rare, but it can absolutely attack your heart. So all of these, it's not to say that all of these symptoms are from Lyme disease. They happen for lots of other reasons, but that's the scary part is that, most people would attribute it to something else and not necessarily that, hey, this could be Lyme disease and it could be treatable. Even chronic Lyme disease, you can treat a lot of these symptoms with antibiotics. Sometimes it requires IV antibiotics at that point, but, can be treatable. I think with Lyme disease, one of the problems is how it's diagnosed. So it's largely diagnosed from the clinical picture. And what I mean by that is you go into your doctor and you tell them your symptoms, what's going on, and they try to piece together of what they think it might be. And so if you say, hey, I got bit by a tick, I have a bullseye rash, I have a fever, it'd be a lot easier to say, oh, that's probably Lyme disease. But if you go in, my joint's kind of hurting a little bit, and that's really the information you give the doctor, it's going to be really hard to, attribute something like that to Lyme disease. There is a lab test, but the lab test has some little problems or caveats with it because it is an antibody test. And so an antibody is your body saying, hey, I recognize that there's a pathogen or something I don't recognize in the body, and they are mounting essentially an immune response. So if you go into the doctor and you have a tick in you, so they say, oh, I'm going to do a Lyme's test and I'm going to see, if you have it. It will almost definitely be negative because you won't have formed any antibodies that quick to the Lyme disease. So again, you could be tested and be like, oh, you don't have it, but really you wouldn't develop antibodies for a while. So that's one caveat with the test. And the other is it's not really useful to say whether you cured the Lyme disease or not. So if you say, if you have symptoms or there's suspicion you had Lyme disease and you receive antibiotics, you then can't use the test because those antibodies are going to be around for months to years. So, it's really a clinical diagnosis and a clinical, did we treat it or not? A few other tips, especially for people in the Northeast, in these areas endemic to ticks, to deer ticks, really if you have a pet and you're going outdoors, the importance of checking the pet and yourself before you come back into the house or before you get into the car. I've had times where I've checked my current dog and have found 50 or more ticks walking around on his fur. Now, they don't burrow in because he has preventative tick medicine that won't allow them to burrow. He also has a Lyme vaccine for animals, so he is protected against it. But what happens is those ticks will fall off in the car, on the carpet, in the couch, in my bed. And so that's really, doing a really good exam of your animal and yourself, before you go back into the house. Because so many of my friends and family have been affected by Lyme disease, and because of my constant exposure to ticks, the vast majority of the time, especially in the spring and fall, when I go outdoors, I find a tick crawling on myself or crawling on the dog. Because of that, I decided to volunteer for a Lyme vaccine clinical trial. So this one that I'm involved in is called VALOR, which stands for a vaccine against Lyme for outdoor recreationalists. And it's a Pfizer vaccine. So this part that I'm participating in is the phase 3 of the clinical trial. And what that means is it's already undergone testing in the lab, it's undergone computer models, it's undergone animal testing. It's gone under phase 1 and phase 2. That means they've already tested it in little groups of people to find the correct dose, to find an effective dose. But now they want to see in the general population, does this work? And are there any side effects that we didn't see so far that over time we could potentially see? And so for this clinical trial, what happens is you go in and they do an informed consent with you where they tell you these are the potential risks. This is what's expected. This is the criteria to see if you meet that. And if you agree, in this clinical trial, you'd go in for 7 visits. 4 of them, you'll receive an injection. So it will either be the vaccine or a placebo. And it's blinded, meaning you don't know what you're receiving. And the other 3 visits are to do lab work. So they're going to check to see, how well your body responded and made antibodies to Lyme disease. They will check to see, if you contracted Lyme disease in between, your vaccines or the placebo if you got it. For this trial itself, it's a 2.5-year trial, and they're enrolling people that are 5 years old to 65 years old in areas that have a lot of Lyme disease. So I'm pretty excited in this area to be able to be involved in something like that, to hopefully have advanced research and have something available for people that are interested, people that frequent the outdoors for their jobs, for their hobbies, that could potentially prevent Lyme disease. If to take away, my advice is that to be aware, to be watching, for ticks, especially if you're going into areas that they are common. If you do get bit by a tick, you don't, freak out. You want to remove it as quickly as you can, as early as you can. How to remove it? You want to grab it with tweezers as close to your skin, which is as close to the tick's head as possible that's burrowed in. And, the tick itself almost has a straw you can think of that it drinks your blood out of with backwards barbed wires. So they do not release easily. In fact, removing them, they'll pull your skin up, but just, slowly and forcefully, keep pulling to remove it from your body. Make a note of what date it was that you had a tick. Maybe take a picture of the tick, a picture of the site, and keep an eye on it if you develop any odd symptoms. If you have the tick, you can take it along with you and say, I was bitten by a tick. Again, if you haven't developed any symptoms yet, if there's no rash, a Lyme's test won't necessarily be helpful. But nowadays, if they're sure it's a deer tick, there's a preventative dose, a one-time dose of an antibiotic they can give you to prevent against Lyme disease. So in case you would develop Lyme disease, you cannot with this single dose of antibiotic. So, go seek medical attention. But my biggest takeaway point is be ready to advocate for yourself. Unfortunately, there's so much unknown about Lyme disease, and there are so many medical professionals that still really don't have it on their radar. They either haven't heard of it, maybe they're in an area where it's less common, or they're not really familiar with how to treat it. So this is a true story. I told a friend of mine in the South who got a bite. It was red all around it. He sent me a picture of it. We just talked about it, didn't think anything of it. And over the next couple months, he started, having really, really tired spells. He actually got on an antidepressant because he didn't want to come out of his room. And I said to him, well, why don't you get tested for like some mosquito-borne illnesses or tick-borne illnesses? I said, if you were up here in the north, I'd say you should really get checked for Lyme disease. And he said, I was visiting the north. And I said, well, why don't you tell your doctor you want to get tested? He said, okay. He went in, his doctor said, okay, well, I don't think it's that, but whatever. And they checked him for an allergy to limes, the fruit. This is, so you really have to be ready to advocate for yourself, even in the healthcare field. You might have to do some education. You might have to go see another doctor or seek out a specialist if you think you have these symptoms or if you think, you have Lyme disease.